And for HR negative was 83%. Again, unprecedented and very impressive results. Stage 2, stage 3 breast cancer, where you would offer the neoadjuvant therapy, and you're trying to compare an anthracycline-free regimen to an anthracycline taxane-based regimen, where you show superiority for pathological complete response with this approach. The PCR rate in the hormone receptor positive group was 61%. Again, very respectable and higher than what we've seen with HR positive breast cancer. And for HR negative was 83%. Again, unprecedented and very impressive results, even in that cohort of patients. And while the study is not powered really for event-free survival, we did see an early signal already with 10% maturity of the data. We're seeing a trend favoring the dual approach of sequential T-DXd followed by THP with event-free survival, which is very reassuring as well. Now, in addition to the efficacy, of course, safety is really paramount, especially in the early stage setting. And it was very impressive to see that with this anthracycline-free approach, we saw much better safety profile compared to an anthracycline-based approach. And ILD rates, which we really want to worry about or think about more judiciously with T-DXd-based regimens, given what we've learned about them in the metastatic setting, with 4 cycles of T-DXd, those rates were much lower. So 4 to 5% ILD rates. So I think overall it was a win. We've been able to beat the bar of historical PCR rates. We're now able to consider for a high-risk patient population an anthracycline-free regimen. We're actually able to have a very tolerable and a better safety profile than what we have had for patients with an anthracycline taxane-based regimen. And ILD rates are rather respectable or lower, which is reassuring. So I think overall, very impactful data.
Wonderful. What a comprehensive and wonderful summary of the data set from DESTINY-Breast11. As you commented, I'm very impressed by the PCR rates, and really remarkable in the hormone receptor negative setting to see a PCR rate above 80%. But let's talk about PCR for a minute here. And you highlighted importantly that the trial was powered to a PCR endpoint, not necessarily an event-free survival endpoint. I think when we talk about PCR as a surrogate of long-term outcomes, certainly in the hormone receptor negative setting, we've seen good concordance with long-term outcomes. And in the HER2-driven setting, the concordance rate is apparent. But what are your thoughts about the PCR rate in the hormone receptor positive group? Is that a group that you would apply the data to? Are you impressed by that PCR data? Or is this something that you'd like to see longer-term outcomes or follow-up?
I think the data were impressive for both cohorts. I do think that when we think about hormone receptor positive group, traditionally, also historically, also, we're thinking slightly lower PCR rates. But the 61% PCR rate that we've been able to achieve in this study is definitely higher than what we've been able to achieve with other studies as well. And so to me, it just makes sense to not necessarily break this data down by hormone receptor status, but if I'm thinking about a neoadjuvant approach, to apply it to both cohorts of patients, because I do think that the PCR was impressive.
Absolutely. I couldn't agree more. I mean, I think that we can't underestimate the PCR benefit here because, of course, it translates to so many subsequent quality of life related issues in the post-surgical setting, right? The burden of a nodal dissection and potential complications thereafter, the use of radiation therapy and so forth. So I think there are a lot of consequential ramifications from this data set.